Now, some clinical anatomy means some diseases or injuries that are occurring in the brachial plexus. Normally, there are a lot of injuries, but on superficially, we will talk about two major things: the upper trunk lesions or the upper trunk injuries and the lower trunk injuries. How the upper trunk injuries occurs? It's very simple, very simple. Consider or keep in your mind that this is uh, this is the neck of a baby. This is the neck. At the time of delivery, if the doctor is stretching the head away from the shoulder, here is the upper part, upper trunk. Here is the lower trunk. Sorry, I will mark the lower trunk with the blue one. I think it will be good. This is the lower trunk. Suppose so, there will be more stretch to the red one, means the upper trunk. So, in your MCQs or in your talks, mock test, they can ask you that doctor is delivering the baby, delivery is difficult, doctor pulled the head of the baby. If doctor is pulling the head, means he is doing something with the head. She or he is moving the head of the baby, taking it away from the shoulder. Just like in this picture A, here you can see the head is going away from the shoulder. If head goes away from the shoulder, between the shoulder and the head, the area will increase, the angle will increase. It will injure the anterior nerve, upper trunk. So, yes, this is another picture. I think picture is not that much clear, showing the that look, they are the doctors pulling the baby's head and increasing the distance between the head and the neck. That is causing the injury or damage to the upper part of brachial plexus. Another diagram. So, brachial, if there will be the injury of the upper trunk, what will happen? I will show you this picture. Okay, so number one, what things were coming from the upper trunk? Let's go a bit back, sorry. Yes, this is the upper trunk. This is the upper trunk. Suppose we have cut this wire that was bringing the electricity, that was bringing the energy, that is supplying the nerve. This nerve is being affected. That is suprascapular nerve, mainly because it has a supply to some major muscles that are the infraspinatus and the supraspinatus. Their function is to abduct means raise the arm and externally rotate, take it out, rotate it out. Okay, one is the major nerve. Second one, here you can, if you can see that this is a musculocutaneous nerve. If you read from your book, it's our nerve root supply will be from C5 and C6. So musculocutaneous is also supplied. What musculocutaneous does? It supplies the anterior arm muscles, means biceps brachii, coracobrachialis, and brachialis. Their main function is to supinate the arm. As we have, you might have read from your books that biceps is the powerful supinator of forearm, and plus it is flexor too. Brachialis muscle is the powerful flexor of the at the elbow joint. One more muscle is affected, that is the axillary, because axillary has most of its supply from this posterior division that coming from the upper trunk. Axillary nerve supplies the deltoid muscle, which is the chief abductor, means helps in raising the arm. So what will happen? The arm will not raise, number one. Elbow will not be flexed, number two. Elbow will not be supinated, number three. These three functions mainly occur. Fourthly, external rotators. As I said, suprascapular, the infraspinatus branch is also the external rotator that gets weakened. Let's yes, now see, arm is medially rotated, means the external rotator are damaged. See here, arm is adducted to the body. This baby cannot raise the arm because here is the deltoid, here is the supinator, and from behind here is the not supinator, supraspinatus, from here behind the infraspinatus muscle. Elbow is extended. Why? Because flexors, the brachialis and the coracobrachialis and the biceps brachii, they are damaged. Forearm is pronated because the supinated, the muscle that causes the supination, powerful muscle is not the supinator, but is the biceps brachii, that is damaged. Wrist is flexed. Better to say the wrist is palmar flexed. This is dorsiflexion. It's also type of flexion, palmar flexed, because some part of a radial nerve can also get affected, especially with the brachioradialis muscle. Okay, so this makes the waiter's tip deformity. Waiter's tip deformity. Nowadays, a lot of people are calling it as a policeman tip, because waiters now started taking tips in a very decent manner rather than the policeman. Okay. Next injury is of lower trunk. This picture will beautifully tell you how the lower trunk injuries occurs. As I have shown you the picture, suppose this is the brachial plexus, this is upper trunk, and this is the lower trunk. If you, this is a normal one, this one is normal. Don't consider that this is pathological or injury. Here the injury is occurring. Here is the upper trunk and here is the lower trunk. Here you can see that angle between neck and shoulder is not increasing, but the angle between the chest and the arm is increasing. It will damage the lower trunk of brachial plexus. Same happening in case of delivery. When the baby is delivered, if the doctor is pulling the hand, the arm of the baby, it will increase the angle between the upper arm or the shoulder and the chest. It will damage the lower trunk. So if the lower trunk is damaged, as we say, if you grossly think, upper trunk damaging the upper part of the arm, means the shoulder and the elbow mostly, while lower trunk damages the hand of the muscle. Lower trunk or the Klumpke's paralysis or the D journey Klumpke's paralysis, it is damaging the C8 to T1. I think we should go a bit back again. Yes, this picture. Very good picture. This is your inferior or the lower trunk. Here, major nerve that is affected is the ulnar nerve. Why? Because these two are sensations. For the sensation, here is the pectoral. This is the branch for the pectoral nerve. So pectoral nerve is also supplied by the other. That will compensate most of its activity. Okay. So the ulnar nerve is the majorly affected, and ulnar nerve mostly supplying the muscles of the hand. When we will discuss about the small muscles or some muscles of the hand, all the functions of the hand means opening of the fingers, that is abduction, closing of the finger, that is the adduction, and movements of thumb, they get affected with the Klumpke's paralysis, and there will be the clawing of the hand, as you can see in this picture too. This region associated with a syndrome that is called as the Horner's syndrome. Why? Because here the sympathetic chain is very close to the lower part of the brachial plexus. So if this damages, it is seen that this also damaging the sympathetic chain, causing the Horner's syndrome, which is characterized by ptosis, means between the space between the two eyelids is closer, means you will see the patient's one eye is properly opened, the affected eye is not properly opened, and the meiosis. With the help of light or the torch, if you see the pupil, that is the opening in the eye, if you see the pupil is constricted on the affected side. And so this was a bit about the grossly about a very difficult but very important topic from the anatomy, that is the brachial plexus. That is very important even on the USMLE step 1 part. So do like my channel Medical Teaching Hub, subscribe and press the bell icon button, and do comment. Please comment for your queries and for the topic that are very difficult for you, especially in the anatomy as well as in the physiology. Physiology we will cover later on, but the anatomy. Okay, Allah Hafiz.